Well, greetings, everyone. My name is Paul Snyder. I am Vice President of Healthcare with Right to Market. We're an Atlanta-based digital marketing and public relations agency and the marketing partner for this series of Pediatric Tech Talk webinars on behalf of the Georgia Tech Children's Healthcare of Atlanta Pediatric Technology Center. Thanks to everyone who's joined us today. And if you're viewing this later, thank you so much for watching along. And please allow me to especially thank and introduce our panelists. Leanne West is Chief Engineer of Pediatric Technologies at Georgia Tech. She is also President of the International Children's Advisory Network. Greetings once again, Leanne.
Thank you.
And Nicoleta Serban is Virginia C. and Joseph C. Mello Professor in the H. Milton Stewart School of Industrial Systems Engineering at Georgia Tech. Her education and research trajectory makes her unique in the pursuit of data-driven discovery endeavors. Thank you all for joining us. I'll do my best to keep watching for questions, but for now, Leanne, take it away.
Thank you. Thank you, Paul. Nicoleta, we're so happy to have you here today. And I was wondering if we could start with you just telling us a little bit about your research at Georgia Tech.
Thank you, Leanne, for the invitation for this Tech Talk. Let me actually introduce myself a little bit too. Well, for those that were going to hear me today, if you wonder about my accent, I grew up in Romania. I moved in the US in 2000 to pursue my PhD at Carnegie Mellon University. My PhD was in statistics, but over the last many years, I've been at Georgia Tech. I'm becoming more an engineer than a statistician. My academic home is in the School of Industrial System Engineering at Georgia Tech, of course. I'm a mother of 8-year-old son. Now to go back to your question, Leanne, in terms of my research is focused a lot more right now on health analytics. And I have organized a group. We're self-organized. We called ourselves the Health Analytics Group. We have a webpage, and I guess that's what makes us a group on our own, a research group. Most of our research is anchored in real problems and questions in the health domain. And the research we perform is all informed by many data sets acquired from various data sources. We have implemented and developed a lot of methodologies, but again, the focus is addressing health analytics problems. We collaborate with clinicians, health providers, the public health entities, like a lot of Department of Public Health in Georgia. A lot of our collaborations are in Georgia, but we also collaborate broadly beyond that. But my pride for our research is actually training the students, PhD, masters, undergrads, really training the next generation of health analytic experts. They really have this firsthand experience with data, with health analytics, with working with collaborators, and I guess that's what I'm most proud of, I think, from my research.
I love that. Of course, that's awesome because you work at Georgia Tech and we love to have our students educated. So tell me about your most either challenging and or rewarding research project you've ever done in the health data analytics space.
Well, I think you've heard about it, and other from Georgia Tech heard about my my very challenging project, and probably that's where this question comes from. It's the project is related obviously to acquisition of a large data set, Medicaid claims data for enrollees in Medicaid programs. Medicaid is an insurance program for lower income and disability, covering a very large number of children and adults, about 50 million a year. Now, this project began back in 2011 to 2012, so it's been a while, and we had a long way until really we were able to work with the data. The project was supported and cheered by Institute of People and Technology, which was its inception also back in those days too. And I also have to acknowledge the support and collaboration with Children of Healthcare of Atlanta. So as part of this project, we acquired a very large database of claims records. Those are patient identifiable claims records. And to date, we have trillions of medical records. And we've lost kind of how much data we have. We have about 7 years of data for entire US. And we have, before 2010, actually, we acquired 14 states also. So we also have older data as well. Now, what makes this project really challenging was that requires skills and expertise in a lot of areas that I actually didn't have, my team didn't have. So we had to really build those skills over time. So we had to set up this highly secure data environment to protect the health records of hundreds of millions of enrollees. We needed to establish the information technology infrastructure. This is a very large, it's a massive data set, but we also need to work with it and then to translate that data into meaningful data. And of course, to analyze this data using rigorous analytics to derive knowledge into decision making. So that was, those were very challenging, but at the end of the day, I really found this project to be rewarding because we're able to derive very informative knowledge and for decision makers.
Yeah, I think having that data set is just really remarkable with the things you can learn from that data from your hundreds of millions of records. And so speaking of that then, what do you find maybe most interesting about the data? What's been the most interesting thing that you've kind of discovered in your analytics of that CMS data?
Where it's if you think about trillions of data, it's there are a lot of interesting things you could actually get from this data. And I'm just going to talk about a few projects, but there are enormous potentials and opportunities to work with this data, to derive knowledge from this data. So some of the examples of project from my research team and my collaborators were, for example, learning about the treatment for preschoolers with ADHD and looking at how their treatment, followed the recommended guidelines. Another project was in collaboration with Children Healthcare of Atlanta. There is a program implemented in that it's an intensive multidisciplinary intervention for children with severe feeding disorder. And that was implemented by Children's Healthcare of Atlanta. And we looked at the cost of benefits of that program versus the standard of care. We looked also at the cost savings for providing really basic dental care for children, for young children. We looked at the outcomes, the health outcomes of children that were born of adolescent mothers. We've looked at asthma, primary care, a lot of other projects, of course. In terms of findings, for example, we found savings of millions of dollars for Medicaid programs, but just providing really a basic dental care, sealants and fluoride for kids, which really doesn't require a lot of infrastructure of dental offices. This can be done in schools. And we accounted for the cost of those interventions in our analysis. We also found obviously cost benefits of the intensive multidisciplinary intervention versus, having children having a G-tube inserted for many, many years. We found that a very small proportion of children, about 16% of children, really follow the recommended care for ADHD, for example. So those findings are really relevant for policy. For example, they can recommend reimbursement for the program that is implemented for children with severe feeding disorder, or it can recommend interventions, for example, dental school programs that can really provide very simple, basic dental care. So there are policies related to scope of practice, for example, allowing dental hygienists or other providers that could work in schools to provide different kind of care, not only dental care, but mental health services. So that is kind of the end point of this work. We find all this, we find all those things that are important for Medicaid children, for Medicaid programs in general, but really the end point is what to do with those. I think that's the most exciting part of my research, I would think.
Yes, so I agree. Being able to do that research and actually make things happen because of it, I think is really interesting. So can you talk about that process a little bit, how you move from your data findings and your research to helping assist with policymaking?
Yeah, I guess that's where this tech talk is about, right? Going from data to decision making, and my team does really take this holistic approach where we've acquire all this large and massive data set. And it's not only that Medicaid, we'll work only with Medicaid data. We actually really acquire data from multiple other sources. And in fact, with Medicaid data, we need to inform that data with other data sets because it's highly coded. If you think about, diagnosis codes and procedure codes, those come as numbers in administrative claims. So you really have to make sense of that Medicaid data using other data sets. And we link the Medicaid data with demographics and other things. So it's a very comprehensive process in terms of this data acquisition, this data science. So there's that portion of it. A lot of the times, a lot of the data is not really organized or structured in a way that we can make sense out of it. So we kind of translate that, all this information, into meaningful data that could be analyzed further. Then we have all this fancy, rigorous methodology, and which is actually was my world before I started this project. All I wanted actually is to develop all these fancy models that do all these fancy things. But in order to get to this point, I had to build on all this other skills and expertise. And by the time you actually really get to the translation of knowledge into decision making, it's such a long way. And often when I start collaborating with clinicians, with decision makers, they lose their patience with us because it's a trial and error process. You go back and forth. You learn about some codes. You run the analysis, you realize that, they're not much, you need to go back and then read more about the specific topic. And then it's kind of a back and forth. And even my students actually, sometimes they lose patience on that. So it's a long process. So it's about a year or two sometimes of effort to get to the point, to get the results. And then at that time, you lose steam, and then it's hard to think about what's next. But that's extra mile that takes you from really the first, the initiation of the project to really decision making, and really getting to the point where this will make sense beyond just research. So and that extra mile makes us at the end our research to be really exciting.
Yeah, so kind of thinking about that, what are kind of the ingredients to working with these massive data sets, and maybe what's part of that extra mile you just mentioned on really getting you there, getting the data there to make a difference?
Well, so most importantly, and then this is what I found with working with the Medicaid claims data, you have to really be fully committed. You cannot really start and then just leave, midway. You're not going to get there. So that full commitment and understanding that there is a process, there's a complexity. There's a complexity of data, complexity of healthcare delivery, complexity of networking. So that's very important. But the second is actually the other ingredient is really is deriving the meaningful data. Really, we need to understand the processes, and then we understand we need to collaborate with those that have the knowledge in order to really make sense out of data. We can do anything we want, obviously, from the data, but if it's not meaningful, we're not going to get the right results and the right, what we need to do out of that information we have. Of course, then it comes the fun part for me, the modeling, there is a lot of focus right now on, and applying for NIH funding and other funding. Rigor is one of the things that is highlighted over and over again, and then so it's important to keep that in mind. And anytime I work with collaborators, I make sure that it's Georgia Tech is committed to provide rigorous research. And then of course that extra mile requires networking, getting to talk to different organizations, being present in the decision-making community. I've participated, I've been involved in a lot of commissions, committees in the state of Georgia, primarily. One of the most recent ones being the Georgia Behavior Health Reform and Innovation Commission, and so that's a long name. But as part of those commissions, I end up to work with and have conversations with decision makers. As part of the presence, I often having formal, informal presentations across the board. I often get those emails. Hi, I learned about your participation in this committee from so and so, and then I learned. Would you be interested to give this a presentation about this topic? And there are various organizations that I've even never heard about them, contact me. And I actually never say no, because it takes 1 out of 10 or 1 out of 20 of such opportunities to really make that connection so that networking. Yes, most often nothing happens after those presentations, but it's 1 out of 10 that really leads to something. And I need to take all 10 of them, in order to get that 1 out of 10. So it's very important to have that presence and be there, and then talk about research, not to academic presentations, but really going beyond, in our community and talking to the community.
Yeah, absolutely. It's actually Rare Disease Week on Capitol Hill in DC. And I've been a part of some of the discussions with some of our senators and their aides over the last few days. And one parent brought up her child who has a feeding disorder. And so I actually took from your findings to add that it's not just about the outcomes of the child, but it can also save the system over $200,000 over the life of the child, the earlier you get the child off of the feeding tube. And so I think that that's what's really amazing about your work, is there's like specific recommendations, numbers and data that you can give to people who are in the decision-making process to help them better understand. Everybody wants to, make sure your kid is healthy. But I think when you put it in terms of dollars, sometimes that's when the legislators will be like, oh, wait, okay.
Yeah, it makes sense, of course, because at the end of the day, they're limited resources, right? So give them something back. It's important. And it's why not? Having both outcomes and savings. It's a win-win, right?
It definitely is. And, and I know that there's so many programs out there that you've investigated and shown that if the state would provide funding earlier to have earlier diagnosis, also have those kind of savings in the long run too. And so it's like, if you put in a little bit up front, you're going to get so much more in the end.
Exactly. It's a long-term commitment. That's what's important to draw attention to.
Absolutely. So is there anything else that I didn't ask you that maybe you want to talk about your group or your research, or maybe a particular project?
So one thing actually I wanna really highlight from my experience, and also I'm probably gonna end with one or two quotes that I really use a lot in my writings. But there are two things that really drove and highlighted my research. One is collaboration. None of the project I've been working on recently have been really single-minded researcher with working with students. I really truly needed collaborations and a lot of most of my research is really inspired by my collaborators. So without collaborations, my research really has no impact, no relation to the world, with the real world. So that's very important to highlight, that if researchers want to have an impact, that is really, we need to network, we need to collaborate, we need to be working together on this project. Another aspect that is part of that, the last mile that I keep mentioning, and sometimes for academics, for researchers, it feels like an afterthought, but I want to highlight that is very important to be part of our research, the community engagement. And that has various meanings, and community can mean a lot of things, of course. But community engagement really creates that catalyst for change, connecting with the right people, going and talking to the right people that want to hear about your research, being out there and having, as I said, presence. And it's very important. And sometimes, our community engagement really gets to have us communicate on a regular basis with community partners and be involved with community partners. And that will take us that extra mile. Without that community engagement, which often we leave it to someone else, we say, well, that's not my job. This is, I'm an academic, I've done my research, I've done my part. I will pass it to those that are, they're in community to work with that. If there's not that conversation with the community partners, we cannot translate the research. There's no translational effort involved. So I really want to highlight the importance of that, and it's becoming more, and I know it's a buzzword right now, and I don't want to, put it out, make it even more of a buzzword, but I think for us, it's becoming more and more clear that extra mile really needs to involve going beyond really publication. Another thing is dissemination, and this is actually some of my work has been this dissemination projects I've done in the last few years. I've started working with Healthcare Georgia Foundation, and they kind of inspired me developing this data portal that provides organized data for community health measures. But I really got inspired by that, because I think it's important to take that and really provide it into apps, into portals, having that data available. And again, as part of that extra mile and that community engagement, because that's how you relate to people, and that's how people know about your research. They're not going to read my research papers. but they can stumble on my data portals when they search for different keywords, and then they can use the data, and without even knowing how, that about all these research papers I wrote about that data. So those are things that I really want to highlight. And I know a lot of Georgia Tech researchers do focus on that. I know you've done some apps too, Leanne. So Georgia Tech is really promoting those efforts. But I want to highlight a lot, again, that this is important for us: collaborations, community engagement, dissemination. And I'm gonna end with those quotes. One of the slogans that I really use it quite a bit in my presentations: "In God we trust, with all others bring data." So this, I think, is so relevant with what we see going on right now, that there's a lot of information and misinformation out there. And for our children, I think we all experience that. We tell them that not to believe everything they hear on TikTok or those apps. My son comes with all this interesting ideas that he said, "Mom, I heard that on the internet." It's like, it doesn't mean that is true. Or somebody else posted something on YouTube and he says, "No, I saw it on the internet." It's like, yeah, but doesn't mean it's true. So we need to really highlight even to our children the importance of data, or processing that data and that information. And the last quote, I really use it a lot, is we've had all these resources, money, oil, they're all actually, but knowledge and data do not deplete. So we can share it. It's going to be there it's for all of us. So, for money, maybe and oil, they're limited resources. Knowledge and data is not a limited resource. We can share it. So that's why I want to share those favorite quotes I have.
Yeah, I totally agree about your community engagement comment. One of the things that I think that we do well, and it's really important, is that we go to our collaborators and say, what questions do you want to have asked? And that way, when you do your research, it's something that matters. It's something that is meaningful to the community, and something that actually can help when you give them the results of your study. So I love that. We do have time probably for one question, and we have a question in our chat. It says, would you talk a bit about how you overcame the challenges of cleaning and or standardizing the large clinical data sets, inputting missing values and things like that? Healthcare data is notoriously inconsistent between EHR instances and between different organizations, in which may have their clinicians document in different ways. So we know there's a lot of issues with clinical data, and how do you deal with that?
So I agree, EHRs, they're different platforms, and that makes it very hard to actually join EHRs. Claims data, one of the beauty of claims data, and this is something that I've always promoted, and we can do that for EHR as well. Claims data is quite standardized. They use standardized codes, standardized procedures, so they have very, very similar structures, regardless whether you look at claims data for Medicaid, Medicare, or Blue Cross Blue Shields. They really use very standardized formats. And I think we could do that for EHRs. It's just the problem is EHRs are those multiple platforms, and that makes them really hard to connect. And if we were able to standardize for administrative claims data, we can do it for other things too. So that made my life to some extent easier. Now, that being said, I agree, claims data, EHRs, medical records is really messy data, and we need to be very careful, and that's a learning process. We need to be very careful how we use that data, for what we use it. We cannot, for example, administrative data is not useful for clinical questions. EHR data is not, may not be as useful for cost outcomes. So there are different uses we could actually have for different data sets. We just need to be aware of all the challenges and limitations of the data sets.
Yeah, and I think that's a real opportunity in the future to figure out how to bring these data sets together that are different, that might be missing information, because there's so much information to gain from analyzing these data sets that we definitely want to be able to have access to as many data sets as possible, because that's just going to make us smarter in how we react to conditions.
Yes, I agree.
I see you back, Paul.
Yeah, yes, indeed. I just wanted to be good on time. So Leanne, I don't know if you want to grab one more question or if you want to put a bow on it and then hand over when you're done, if you have anything else you'd like to add or share.
We do have one other question in the chat, and it says, how can researchers organize or arrange large data sets early in order to make the translation and decision-making more successful? So a little bit related to the last question to some degree, but yeah.
Yeah, it's partnership. I wouldn't be able to do this without partnering and without convincing Georgia Tech. This is a great, the project of Georgia Tech's life. But I done that partnering. So Institute of People of Technology was the partner for me back then. Without that, I would not have been able to do this. Collaboration, again, we had this collaboration with Teacher Haircare of Atlanta, and they were very supportive of this project. So having those partners and collaborations will help make things happen. We cannot do things alone. I cannot highlight more of this. And for me, that was very important. When I started this project, I was assistant professor at Georgia Tech. So I wasn't, I had that support, even though, it was just very early in my career. So that's very, very important to find the right partners. And there is a lot of support at Georgia Tech and beyond, of course.
Yep, and we do love our partners, especially Children's Healthcare of Atlanta, in the pediatric healthcare space. I know they've been a great supporter of a lot of the work you've done over the years. So like Paul said, I think we've come to the end of our time. And I want to thank you so much for talking with us today about data sets and what you can learn from them and how you can actually make that information actionable. I think it's been really interesting and I appreciate it.
Thank you, Leanne. I really appreciate also this opportunity.
Absolutely.
We know we didn't get to touch on every aspect of the topic. If you have additional questions, we encourage you to send those to Sherry Russell via email, and that is SHERI.Russell, RUSSELL @gatech.edu. So thank you everyone for taking the time to join us. If you're watching not live, thank you for taking the time to watch and learn with us. We will archive this on the Pediatric Technology Center website in case you'd like to reference it at a later date or share with your colleagues. So with that, I wish everyone a wonderful day wherever you are, continued good health, and we will be in touch when the next Pediatric Tech Talk topic gets set and scheduled. So thanks everyone. Thank you, Nicoleta, and thank you, Leanne.
Thank you.
Bye.
Bye.